Hi, it's Dan here from The House of Mouth. In this episode of Common Concerns, we're going to talk a little bit about bleeding gums. So if you've noticed your gums bleeding when you brush or floss or when you're having something to eat, you're definitely not alone. It's actually one of the most common oral health concerns that we find here in Australia and also worldwide. And national surveys show that around 1 in 3 adults, believe it or not, experience some form of gum bleeding or inflammation throughout the year, which is massive, right? So although it's common, it's not something that we would like you to ignore because it's often your gums are giving you some health information to say, hey, you know what, they need a little bit of extra care. So today we're just going to run into a little bit of information about what bleeding gums is, what can often cause them, and then some really simple tips there that can help guide you to help prevent that from happening in the first place. And then also importantly, if those things don't improve your conditions there, when to actually seek help from a professional. So let's start with bleeding gums. Bleeding gums are usually a sign of inflammation. Now there's a whole variety of reasons which actually can cause your gums to become inflamed and start to bleed, but one of the major factors is plaque. And when plaque sits along the gum line and on your teeth, the gums naturally become tender and swollen and they're more likely to bleed. And that's actually, believe it or not, part of your body's natural protective mechanism. So one important thing to know is that bleeding doesn't happen just because you're brushing too well or too hard. Yes, brushing too hard or flossing a little bit too vigorously with your floss or interdental products can cause bleeding, but it actually happens because the gums actually, believe it or not, need more effective cleaning, especially around the edges and between the teeth where plaque builds up. We actually often get a lot of patients coming in and they believe that because they're brushing a little bit too hard, that's just simply the reason why they're bleeding. But when you actually effectively clean your teeth better, you can actually reverse that and then the gums will actually stop bleeding or will actually reduce the amount of bleeding that's happening if that's as a result of plaque sitting around the gums and teeth. The important thing to know is this happens to everyone. So even the best brushers can actually find that their gums become inflamed and as a result their gums start to bleed. And this can be what we call localized, so isolated to 1 or 2 small little areas in the mouth around a particular teeth or gum area, or it can be more generalized, meaning that it's affecting the mouth and the gums in a wider capacity. And what we do know is, life gets busy, right? Stress affects our health. Our technique often shifts over time, and sometimes we're not always onto our brushing and flossing and oral health as best as we possibly would intend to or really would like to be doing. So if you've been noticing bleeding, it's not necessarily a sign that you've done something wrong. It's simply a sign that your gums need a little bit more support, a little bit more TLC, and a little bit more help. So what I'll do now, I'll run over some common triggers which actually can cause your gums to bleed or your gums to become inflamed in the first place. So the first one there is not cleaning right along the gum line and between the teeth. Now what we do know is, as we've spoken about in previous videos, so if you're just simply brushing every day and that's it, you're not cleaning between your teeth, a lot of the tooth surface area there that you're missing, with the chance there that the plaque is not being removed adequately. Also plaque build up from rush brushing. So we all know that ideally we should be brushing our teeth 2 minutes in the morning, 2 minutes in the evening. And sometimes, if we're running out the door to work or trying to get the kids out to school, we don't always brush for 2 minutes. We may be super tired in the evening, may fall asleep on the couch, and we may only, get 30 seconds in, if that. What we do know is 2 minutes is the ideal amount of time there to remove the most amount of plaque and try and prevent that inflammation and bleeding. Hormonal changes is also a big one, particularly in situations like pregnancy. So we do know there is a condition called pregnancy-induced gingivitis where hormones increase during pregnancy, and that's actually reflected in the gums becoming temporarily inflamed and therefore bleeding more. The great thing is often sometimes those hormonal changes can be temporary. So once the pregnancy has passed, then you will find those hormones will then drop, and then naturally the pregnancy-induced gingivitis will then drop off and improve back to health. Some medications also can contribute to bleeding gums and inflammation and early gum disease. Now the really important thing is early gum disease is often a result of all of the above that we've spoken about, where it's not being adequately addressed. And the great thing is with early onset gum disease, it's completely reversible. So if you get that in the early stage, you can revert the gums back to health. What research actually shows is that, believe it or not, 40% of the tooth surface are missed. So there's a lot of area there of the tooth surface where a lot of plaque can sit if you're just brushing alone. So it's really, really important that we're brushing and we're flossing every single day. So at least flossing once a day, brushing twice a day. The great news is that the gums actually respond really, really well to consistent care. And as I mentioned there before, early onset inflammation, bleeding, and even gum disease such as gingivitis, in the early stages there, it's completely reversible. So you can actually completely reverse those gums back to a healthy state where they're no longer bleeding and they're no longer red, they're no longer puffy, and they're no longer inflamed. So to help manage that, here's a few simple steps that help to make the world's biggest difference. First of all, brush gently along the gum line, as we discussed there before, so it's really important to do some nice big circular strokes, so you're brushing not only the tooth, but also the gum as well. Always treat the gum like the foundations on the house, so it's important to keep those foundations nice and clean and nice and healthy as well. Always use a soft bristled toothbrush, so just by using a harder bristled toothbrush, you're not going to do a better job. Plaque is soft and it's sticky in the early phases there, so using a soft bristled toothbrush is all you need, and that also helps protect the teeth and gums as well, so you're not going to be doing damage, particularly if you are finding that you are one of those people that brush a little bit harder than what you should. Always clean between your teeth daily, so whether that's with floss, interdental brushes, or an electronic water flosser, definitely important to be doing that at least once a day, along with twice daily brushing. And where needed, choose gum supportive products, so any anti-inflammatory rinses or gum toothpaste or anything that your professional there is recommending as an adjunct to what you're already completing above. The important thing is these products shouldn't be used to replace brushing and flossing. They should be used in conjunction with that to help support all your really great habits that you're doing every single day. And probably the most important thing is consistency is key. So gums often improve very noticeably and very, very quickly with about 1 to 2 weeks if you're being very consistent every single day. So that's the really important take-home message that I must really stress there, that consistency is key. So you often find that, as patients there, they come in, they have their teeth checked and clean, and they become really, really motivated. They're cleaning between their teeth really well, they're brushing their teeth really well for a good couple of weeks after they come and visit us for their clean and their checkup. And you often find, life gets in the way, and sometimes oral care is then pushed aside, bleeding gums, and then follows through with inflammation and those sorts of things. You start noticing those symptoms yourself. The important thing is all of those things, if you're doing regularly, will help prevent them from the outset, but it is important to know when to seek professional help. So if you're finding the bleeding is still continuing despite running through all of those recommendations, or if it's worsening, or if you're finding the gums are becoming more swollen or tender, you're noticing a change in your breath, so you're noticing a bad breath, it's definitely worth checking with your dentist or oral health professional. And the great thing is they can kind of guide you in the right direction there, depending upon your individual situation and scenario. So just the important thing to realize here, everything I'm sharing here is completely general guidance, so it's just to help you understand what might be happening, but it doesn't replace personalized advice from your dental or healthcare professional. So at the House of Mouth, we offer a large range of gum supportive products, so everything from toothbrushes to interdental products and specialist toothpaste and mouthwashes to help support your everyday oral health. So if you are looking for any particular guidance or for a particular product, have a look at the products below, or alternatively reach out to our team and we'll definitely be more than happy to help guide you in the right direction. So all the best with your gum health and oral care journey, and we're here one step away if you do need any assistance.